So a stuffy nose is extremely common, and generally speaking, it is not at all serious or nothing to be overly concerned about. We get concerned as clinicians if a symptom is persistent and progressive. So one concern for us would be a unilateral, i.e. one-sided nasal obstruction or blockage that gradually keeps getting worse and worse until it is completely obstructed or completely blocked. Another issue that we will be concerned about with a stuffy nose is if we have blood-stained discharge, again, particularly if it's just on one side over a period of time. But generally speaking, stuffy nose in general to both sides, particularly if it just comes and goes, is not a particularly serious problem. But is also, unfortunately, of course, quite common and something that we deal with quite a lot. So a stuffy nose is extremely common, and the most common cause of problems with a stuffy nose is allergy to the environment in which we're in. So the most common cause for that would be hay fever that most of the general public are aware of. This is a specific type of allergy to certain types of grass pollen, particularly hay, for example. In medical terms, we call this allergic rhinitis, and there are two main types of allergic rhinitis. So there is seasonal allergic rhinitis, of which hay fever is the most common type, and there is perennial allergic rhinitis, where patients can have a stuffy nose at any time of the year and sometimes all year round. Unlike with grass pollen allergy, which is predominantly hay fever or seasonal symptoms, perennial allergic rhinitis, the most common allergen or item that causes those allergies is house dust mites. Now, these are present all around us at home. They're in soft furnishings, in beddings, and there's no real way of completely eradicating these. But this is the most common cause of a stuffy nose or allergic rhinitis. Other things that we can be allergic to might be our pets. So cat allergy and dog allergy is surprisingly common. And what is interesting is that some patients can have cats and dogs for many, many years with no problem, and then suddenly develop an allergy to them. Certain trees in the garden or grasses in your nearby environment may also be common causes of these sort of symptoms. Slightly more concerning or more worrisome than simple allergic rhinitis are islands of allergy-related inflammation that can occur on the nasal lining, forming something we call nasal polyps. Now, nasal polyps are also quite common. These can be caused either by allergy itself, but occasionally by other conditions. But generally speaking, they're normally pretty well treated. Other causes for a stuffy nose that are not allergic related may be migraine, for example, and migraine quite commonly causes a stuffy nose. One of the common things we see in ENT quite a lot is patients who present with facial pain and a stuffy nose. And almost always this is misdiagnosed as sinusitis. Generally speaking, however, a stuffy nose is very rarely a cause of sinusitis, a symptom of sinusitis itself, unless we have pus discharging from the nose. So generally, the take-home message is the most common cause of a stuffy nose is allergy to things in your environment, particularly house dust mites. But if you're having facial pain with a stuffy nose, it is not sinusitis unless we have a green or pus nasal discharge from the nose itself. So sleeping with a stuffy nose can be quite uncomfortable and can be quite tricky. We've all had colds and coughs which makes it quite difficult and uncomfortable to sleep. Generally speaking, if we have a stuffy nose a large amount of the time, as I mentioned previously, this can most frequently be caused by allergies. And house dust mite allergy is the most common allergen that tends to cause these symptoms. Now, unfortunately, dust mites tend to be most prevalent in bedding, so in pillows, duvets, mattresses, for example. And therefore that can make patients have worse stuffy noses, particularly at night, when they're in bed, when they're trying to sleep. Therefore, the use of medication can help with this. We cannot completely eradicate house dust mites, but we can use hypoallergenic bedding. So this is bedding that you can buy from various shops and supermarkets that are specially designed to limit the amount of house dust mites that are able to survive within those fibres. If you have asthma as well, which can also be accentuated and made worse and exacerbated by house dust mites, making sure you're treating your asthma well with regular inhalers can also help you sleep. But most commonly using topical steroids, so that's nasal steroid sprays or antihistamines with mild sedative effects, can actually help us sleep at night. A stuffy nose is most commonly caused by allergy to various different atmospheric pollutants. So avoiding known allergens is probably the most common way in which you can clear a stuffy nose. So if you know, for example, that you are allergic to cats or dogs, avoiding them is probably the best way of avoiding symptoms without needing to see a doctor. Saline nasal sprays and saline washes and simple water washes to the nose is also very effective. That can physically wash out any allergens or any particles in the nose that may be causing inflammation. And there are many over-the-counter steroid sprays and antihistamines that are also really effective for patients who have allergy-related nasal inflammation. One word of warning, however, is the overuse of nasal decongestants, which unfortunately is quite a common problem. So nasal decongestants work very effectively. They reduce the blood supply to the lining of the nose, therefore reduce the swelling of the lining of the nose and open up the cavity. Unfortunately, however, there is a well-known phenomenon that if you use topical decongestants, so decongestant sprays within the nose for more than about 4 days in a row, it will cause rebound inflammation of the nasal lining and actually make the symptoms worse. We see a lot of patients who overuse topical decongestants, and there is even a medical name for it. It's called rhinitis medicamentosa, so medication-induced rhinitis. So the mainstay of this treatment really is saline washes to the nose to physically wash out the allergens, avoiding the allergens themselves, and use of over-the-counter steroid or antihistamine nasal products, and avoid long-term decongestants. So if your symptoms are not getting better, or as we said before, are persistent and progressive, so they're gradually getting worse, it's really important that you seek help from your GP in the first instance, and ultimately from us in ear, nose and throat surgery by a referral from your GP to secondary care. Generally speaking, most medical conditions that affect the nose, i.e. allergy, inflammation, nasal polyps, for example, are treated medically, and very, very rarely is surgery required. Unfortunately, allergic rhinitis is not curable. We cannot live in a bubble. We cannot get exposed to particles in the atmosphere. We have to breathe on a daily basis, and therefore we cannot cure this condition, but we can manage it with medication. And generally speaking, surgery is not the answer to allergic rhinitis, as surgery will not correct an underlying inflammation of the lining of the nose due to allergy. So in most cases, medication, i.e. nasal sprays and occasionally tablets, can help.